Hi, everyone. This is Mike Peresie. I'm the Senior Vice President and General Manager for Change Healthcare's Medical Network business. I want to thank you all for the opportunity to share a little bit about some of the things we're doing to help improve the member experience in healthcare. Also want to thank AWS for the opportunity to present. And I'm really looking forward to sharing a little bit about how we've partnered with AWS to create a better member experience. Today, I'm going to talk just briefly about Change Healthcare for those of you that aren't familiar with us. And then I want to dive into what's happening in the marketplace and specifically touch on a little bit of the regulatory environment and what that means for consumers and for health plans and for providers that are operating in that system. I want to talk a little bit more about then, what does that mean to go beyond just the regulations and how a lot of our customers are thinking about member engagement as a differentiator, and thinking about, what can we do to truly solve the challenges that those regulations are intended to address. And I'll also touch on how AWS has been a great partner in terms of bringing us capabilities that we can use to help deliver on that vision. So really quickly on Change Healthcare, we're truly building a platform here at Change Healthcare. We are focused on solving challenges, improving efficiency, reducing administrative burden across both financial, clinical, and operational flows. We have a pervasive footprint across the healthcare ecosystem with over 1 million physicians, thousands of hospitals, and each year we process over $1.5 trillion worth of claims and over 15 billion healthcare transactions. So we're focused on leveraging that connectivity and that footprint and some of our capabilities, and then powering a platform that can be used to help improve the outcomes across the healthcare system and truly create a healthcare system that works better for everybody. With that in mind, when we think about the actual healthcare experience, we're trying to leverage our platform, whether it's data or connectivity or our position in the ecosystem, to help consumers better navigate that system, which includes all the steps in the journey from finding care, so identifying their provider, understanding what it's going to cost, scheduling an appointment, to actually receiving that care, bringing maybe the relevant healthcare data along with them, having their ID card available to them for their appointment virtually, all the way through to the end goal for a lot of providers, which is then ultimately after you've taken care of the patient, you've delivered the care, getting paid for care, which is actually one of the most confusing. And I'm sure if I asked everybody on this call to raise your hands, you'd agree. It's one of the most confusing processes in healthcare, is trying to understand what you're going to have to pay, and then ultimately, when you get the bill in the mail, determining if it's exactly really what you owe or if somebody along the way may have made a mistake. And so that healthcare journey today for consumers is extremely confusing. And we're trying to leverage our platform to help solve that. So I want to take a minute just to double click then on, what's happening in the market as it relates to consumer navigation challenges that consumers, all of us, are facing. And then how regulations have come to bear to help address some of those challenges and what that means for participants in the system, and how we can help. So just to give you a little bit of context as you think about the e-commerce world that we all live in today, we've done some research and looked at some research that's available. And if you ask consumers, 81% think that shopping for healthcare should be just as easy as any other service they buy. 76% say, I wish there was a single place that I could shop and purchase for healthcare. 67%, wish they could shop for healthcare entirely online. And, 58%, so over half, just wish that a technology company would come in and rebuild the whole healthcare system to create a new healthcare experience. So what's clear to us from all the research we've done is that consumers are looking for an easier shopping experience, especially as consumers are starting to bear a much higher portion of the costs, right? Insurance is paying for less and less. High deductible plans for insurance are becoming more common, which means that people are actually paying money out of their own savings account, their own bank account for their care, and they want to be able to make smart decisions about how to get the most out of that. But the challenge with that is that most consumers today are struggling mightily when it comes to making those kinds of decisions now that they're becoming the primary payer. So 67% say they feel like the whole process is a chore. 62% say that the experience feels like it's intentionally set up to be confusing. And 56% say the experience is so bad today that I know people that are actually just avoiding care altogether because they're throwing their hands in the air and saying, I don't know what it costs. I'm confused. I don't understand my benefits and coverage. I can't make decisions. It's frustrating me. I'm just going to put it off for later. And that's actually the worst thing you can do, because then that's affecting the care outcomes. So what's happening now is that Health and Human Services and CMS have stepped in and introduced some rules. And those rules are intended to address some of these challenges, that you have consumers that are paying for more of their care, but they're having a very difficult time navigating that environment. And so what CMS has done is introduce price transparency regulations that are requiring health plans to provide better transparency tools and information to their members. And there's a couple of deadlines that have come out as it pertains to these regulations. The first was in January of 2022. Every health plan has to publish 3 machine-readable files posted on their website with monthly updates. And those have to include their in-network provider negotiated rates. So not just derived from claims or estimates, but the actual rates, the billed charges and historical out-of-network allowed amounts for any out-of-network provider. So any provider where they have more than 20 claims that they've paid that provider on an out-of-network basis, they have to publish that rate. Even though they don't have a contract with that provider, they have to just publish their experience. And then the last machine-readable file needs to include the negotiated rate and historical net price for prescription drugs. So having prescription drug information available. Then if you fast forward another year, health plans are required to have an online self-service tool for 500 shoppable services. So not just having the pricing schedule available, but actually having a tool that allows consumers to shop for over 500 services. And then the last piece of that is having online pricing and cost sharing for all items and services. So taking that list of 500 and expanding it out. So to make this look a little bit more easy to understand, I wanted to just give you an example of Carly. Carly's a mom whose son needs a medical procedure, and Carly's thinking through a lot of the things that many of us have thought through as we've been navigating the healthcare system, right? So when your son needs a medical procedure, the first question is, what's it going to cost? Second question is, how much will I have to pay? Is it going to be covered by my insurance, and by how much? Where should I look for a doctor? What's the difference in cost by doctors? What's the difference in quality? How do I choose? And then ultimately, with the goal of, the primary goal being, I want to make sure my son gets the best possible care. And so in order to make those decisions, you need to have good information. And in our daily lives, right, we can go to various different, retail shopping experience websites and read reviews and read third-party rating reviews of quality of services and products and make intelligent decisions. And the price is right there on the website. But when it comes to shopping for healthcare, that's just not the case. So in order to then meet some of the challenges of the regulation, which is really intended on helping consumers navigate care, we believe health plans have a real opportunity to embrace this, take a leadership position, and not just achieve what the regulation requires, but turn it into a competitive advantage. And in order to turn it into competitive advantage, you have to be able to enable price transparency across the journey in a way that's really easy for people to understand. So there's kind of 2 different sides to this slide that I've put up here on the screen. One is a secure experience, right? A secure experience that you want to be able to provide to a member that allows that member to not only have access to just the basic information that's required under the regulation, which would be the machine readable files with the price sheet, et cetera, but also be able to provide that member with customized and tailored information that considers things like, how much of my deductible have I met? In terms of my accumulators, what's my deductible to begin with? What's my cost share? What's my true out-of-pocket going to be, based on my specific plan of benefits? So that data that powers that algorithm has to be very consistent, has to be personalized, and it has to be up-to-date and accurate. If you look at a public experience, you have to be able to provide a digital, storefront or a digital place where someone can come and access that information. They have to be published in those machine-readable files. But then also you may want to be able to make that accessible via APIs. In order to enable all of that, you need an underlying transparency engine, and that's some of the technology that we've built here at Change Healthcare. So you need to be able to manage pricing data in a multi-format, flexible capacity. You need to be able to calculate the benefit, so really understand the benefit design and how it's going to apply to that specific shoppable service and how it then applies to that specific individual's cost of care, which is a complex set of analytics to run through. You also have to be able to group things together, because oftentimes healthcare charges are itemized, but they're one episode of care or one scheduled shoppable service may include multiple charges. And so you have to be able to bundle things appropriately around a care episode or around the way that they're bundled for the purpose of the contract. And then ultimately, you have to also be able to augment that with other information around quality and experience that consumers want to have as they shop for care, because they don't just care about the cost. They also want to know, is this a good doctor? Is my son going to be more healthy? So we've really focused on doing that at Change Healthcare. We've established web-based application with API delivery of that cost and member-specific data. We've been recognized as best in class for that. We're able to drive that personalization. We're able to drive that engagement for over 1,000 medical procedures and pharmacy costs. We've done a lot of that in partnership with AWS. So I'm going to show you just a little bit of what that looks like in sort of the live view of how we've been able to build an application that can power this kind of an experience, to give you a flavor of that. And then I'll touch a little bit on how AWS has helped us at the very end. So TrueView Plus is the name of our solution. It's a flexible platform. It's personalized. You can see here from the user experience, you can find the right care. It gives you accurate information about your out-of-pocket deductible, the spend that you've spent this year. It allows you to search for providers through an intuitive user experience that's friendly for a shopper who's trying to identify what their care is going to cost. We also have TrueView Plus, which will then allow for a lot more customization on those shoppable services, where you can then incorporate things like, as you can see on the right side of the slide, ratings and reviews for the provider, information on their address, location, and the details of the cost. So not just what's the total cost, but exactly what the plan pays and exactly what you pay, so that you can understand when you book that service, what you might be making in terms of a cost or quality trade-off, and make an informed, intelligent choice about where to get your care. And then ultimately then for the plan itself, we have a reporting dashboard, and that reporting dashboard then allows you to see how members are engaging with the tool, so that you can make changes, so that you can optimize your engagement strategy and glean insights from that data to help you manage your members' care better. What's great is all of this has been built and powered by AWS. So TrueView Plus is powered by AWS. We use S3 buckets for asset storage. We have all of our backend servers on EC2 instances. We use AWS's version of Elasticsearch for indexing. We use Redshift for data warehousing, Kinesis Firehose for all of our event logging. So, and literally all the services that you see up here that aren't highlighted in red are things that we use across Change Healthcare's enterprise in terms of leveraging the platform and the power of the AWS platform. So, I've personally found that as we've moved forward with partnering with AWS, that there are a number of benefits. It's not just the reliability and the scalability that you get from moving to the cloud. It's that we know we can trust AWS for information security around really sensitive healthcare data. But I would say the number one thing for me, it's really all about speed. In the marketplace we live in today, it's critical that we all operate with velocity. It's a very competitive market. The market's changing fast. We have to be nimble and flexible, and we have to be able to bring solutions to market or change our solutions very quickly. We also want to build things on platforms that have continuous pipelines of innovation. And I've just found that that's been the experience with AWS. So we're very happy with our partnership. And thank AWS again for the opportunity to just share a little bit about how we're leveraging their platform and building a new member engagement capability to help change the healthcare system. And so I want to thank you all again for your time and sharing a little bit about Change Healthcare, and wish you all the best. Thank you.